The second cell adaptation is hyperplasia. Hyperplasia is an increase in the number of normal cells, caused either by increased functional demand or by growth factor or hormonal stimulation. Hyperplasia takes place if the tissue contains cell populations capable of replication. It can only occur in labile or stable cell populations. Permanent cells are highly specialized cells that cannot replicate. So the permanent tissues, nervous, skeletal muscle, and cardiac muscle, only undergo hypertrophy and not hyperplasia. Hyperplasia can be physiologic or pathologic. There are two types of physiologic hyperplasia. 1. Hormonal hyperplasia. 2. Compensatory hyperplasia. Hormonal hyperplasia, exemplified by the proliferation of the glandular epithelium of the female breast at puberty and during pregnancy. 2. Compensatory hyperplasia, in which residual tissue grows after removal or loss of part of an organ. For example, when part of a liver is resected, mitotic activity in the remaining cells begins as early as 12 hours later, eventually restoring the liver to its normal size. In anemia, hyperplasia occur in red cell precursors. Red blood cell production may increase by 8 times. Pathologic hyperplasia. Most forms of pathologic hyperplasia are caused by excessive hormonal or growth factor stimulation. Endometrial hyperplasia. Endometrial gland hyperplasia, which is caused by an increase in estrogen, and an increased risk of developing endometrial cancer. We will explain it in detail in another video. B. Benign prostatic hyperplasia is another common example of pathologic hyperplasia induced in responses to hormonal stimulation by androgens. Unlike endometrial gland hyperplasia, there is no increased risk of developing cancer. In this image you can see the prostate is enlarged and nodular. Stimulation by growth factors also is involved in the hyperplasia that is associated with certain viral infections, for example. C. Viral infections. Skin infection by the human papillomavirus, HPV, produces epidermal hyperplasia or the common wart. In this image you can see a multiple papillomatous warts, papillomavirus, on the hand. D. Goiter's disease. Iodine deficiency produces thyroid enlargement as the gland works harder to increase thyroid hormone synthesis. Both hypertrophy and hyperplasia are operative in producing goiters. An important point is that in all of these situations, the hyperplastic process remains controlled. If the signals that initiated abate, the hyperplasia disappears. Nevertheless, in many cases, pathologic hyperplasia constitutes a fertile soil in which cancers may eventually arise. For example, patients with hyperplasia of the endometrium are at increased risk of developing endometrial cancer. There are two mechanisms of cell hyperplasia. The main mechanism of hyperplasia is the production of growth factors, which stimulate surviving cells, after cell loss or injury, to synthesize new cell components and, ultimately, to divide. Another mechanism is the increased output of new cells from the stem cell network.